everyone, welcome to this week's Health by Ratio vlog, where we cover everything from injury rehab to prevention to maximizing athletic performance. We try to take a look at the holistic approach in every avenue on how we can get our bodies optimally performing the way we want. So today we're going to finish up our conversation on rehabilitating, retraining, and maximizing the potential up for our knees, and those of us either feeling like the knees are starting to go, or feeling like been dealing with chronic pains and injuries in them for periods of time, or are coming off of a major surgery. It is a chronic epidemic. It's over half of the injuries are occurring or happening without any contact happening in and of itself. So it's just by our natural movement patterns, like we established in previous weeks from people like Gray Cook. We've determined that it normally has to do with something going on in the ankle, the hips, or both, that are causing things like knee valgus to occur, or our feet turning and our knees collapsing inward, that cause shearing effects on the knee. So we first went into how to mobilize and correct the ankle imbalances. That was from a couple of weeks ago. If you haven't gotten a chance to check that out, do it. It gives you some great self-assessments to see if your ankle's dorsiflexion might be linked to the knee pains or injuries that you've been experiencing, as well as our hip mobility to see if we might have any issues from our single leg stance positions to our external and internal hip rotation. And we went through different patterns and techniques you can do to mobilize those areas and increase some range of motion, and did a little bit of exercises to showed you a few exercises to help correct your imbalances. But today we're actually going to get into more of the proprioceptive part of the functional rehabilitation process. And I would say that this is one of the biggest aspects that is missed in most of our standard physical therapy and rehabilitation processes. Not because it's a fault on any one PTs. Often it's because of either a lack of education in this kind of stuff. Often these are things that are taught kind of above and beyond what we typically are taught in our kinesiology and biomechanics degrees and stuff like that, as well as it's a simple lack of time. A lot of times they have the knowledge base, and we have the capabilities of getting someone there, but we only have so many visits with them, and our goals often end up being to try to be pain management and to get us to a certain level of functionality, but it's a far cry away from being able to do 10 step-ups without pain and being able to ski down the slopes in your 60s like Robert's doing right now, after going from a full grade 3 ACL tear. So we're trying to make sure that we're retraining our body's central nervous system to naturally hold us, and the right way. And proprioceptive exercise is basically a fancy way of saying exercises that naturally make your body have to pull itself into alignment, or it's either going to feel really, really wonky and off for you, or you're going to fall over. So it's kind of the idea that if I was standing next to you and I pushed you and you naturally just kind of rebalanced yourself and regathered yourself, that's a proprioceptive response. That's your body regaining its balance and stabilizing itself again. Well, that's what these exercises are trying to do. So without further ado, going into some techniques that we use with our clients. Now, there are quite a few, but I actually went into my old program on how I rehabilitated my MCL, meniscus, and patella tendon for this. So these were some of the moves that I specifically did, along with how we got Claire to get her successful college recruiting happening, and how we were able to get Robert back onto the slopes even though he was in his 60s and beyond. So this is what we've done many times over with clients. I will say that we often expand on this depending on what the individual needs, but it gives you some really good ideas and places to start with. So starting off, I have a couple of lighter super bands set up here where basically I'm going to use them to help me play around with my balance and my stability, and again, cause my body to self-correct what's going on. So for instance, one of the things that we need to do is really make sure that our hips and our feet are stable in the single leg stance positions. So getting ourselves in the single leg stance position and doing just simply a single arm row, pinching your shoulder down and back while focusing on keeping your plant foot's knee so that it's dead straight and aligned the whole time. You don't want to feel like it's collapsing inward, is an easy first step to getting your single leg stance worked while you're doing rows. You can also do this in a straight arm pull down manner where you're bringing the arm straight back to get just a little bit more advanced as you're going through this. A lateral position that I like for your core is going into, again, a single leg stance, bringing your bands to chest height where you're perpendicular to the anchor point and going into what's called an anti-rotation. So you're punching this band out, focusing on keeping this knee into alignment, but not allowing your torso to get pulled into a twisted position toward your anchor point. You want to keep everything dead center as you're going in and out of this. Going for anywhere between 10 and 15 reps per leg, per side, per arm is perfect. So that's what we're aiming for to train proprioceptively our core a little bit, as well as training our back and single leg stance a little bit. We can also go into, we mentioned last week, going into things like monster walks, lateral band walks, glute bridges, all with a super band positioned around the knees themselves, so that as you're, and half squats, I'll actually show that again right now. I reference as you do these movements, the band pulling you to the inside is proprioceptively causing you to correct your knees from caving in. So to keep your knees to that mid-foot or to the outside alignment, you have to naturally fight the band, which is proprioceptively firing your glutes. So you can use something like a super band and even a heavier one if you want, or a TRX, or you can even just hold on to like a door frame right here and going in and out of squats, keeping those knees out to the sides, focusing on as you come up, engaging the glutes, keeping the core tight, making sure the feet are pointed straight ahead. We don't want the feet turned out to the sides as we do this. We want the feet pointed dead straight the whole time and going in for, again, 10 to 15 reps. That's a great step in the right direction for proprioceptively training your body how to squat the right way. The other thing that I really like to do to wake up the glutes a little bit more, I'm going to actually incorporate a dumbbell in this, and I'm just going to pick a really light weight to make it easy for my demonstration. But you can add weight, you can do this body weight, either works, but using a band that's connected low to the ground this way, I can hike this band up toward my hip level and then walk out against this band. So right now, it's pulling me down and back toward the ground. What that's doing is my tendency is to want to sit my butt back. So for me to stand upright, I'm literally thrusting my hips forward, which is naturally firing the glutes. Because this band is still giving me tension, pulling me inward, I am having to keep the knees from collapsing in at the same time. So that's getting my glute medius. Keeping my feet straight, my core tight, I'm going to go in for squats where as I stand up, these two bands are causing my glutes to fire that much more with each rep, focusing on the core and the glutes each time I stand up. I can also go into straight leg deadlifts in this position. So I'm in my stance, my knees are being pulled in a little bit, my hips are being pulled back. I'm going to keep the core tight, bend forward. I'm doing this single arm. You can do this holding on to your weight with two arms as well. But single arm gives you a little bit more off balance. Again, you're engaging that core now naturally proprioceptively because it has to compensate for having an uneven weight to one side. But if it's too advanced, if you're just getting started on this, doing it with two arms and keeping the weight centered is totally fine. But every time you stand up, keeping the core tight, thrusting those hips forward and engaging the glutes. These are a couple of proprioceptive exercises to work through in the squat pattern and the hip hinge pattern, which we care about directly if we're doing anything that involves jumping or holding a squat like when we're skiing, or in an athletic stance to start off with a certain event like tennis. You're always starting off in that athletic stance. Football, you're starting in that stance. Basketball, you're jumping through there. Volleyball, you're loading up and jumping. Basically anything that involves any kind of squatting or sitting pattern, we care about this. The other pattern, and the hip hinge, I should say, is just as applicable. We often are hip hinging more than squatting when we're jumping, especially jumping forward. We're loading more from the hips versus loading more from the knees. It just depends on the direction. If you're jumping more vertical, you're probably going to be squatting a little bit more from the knees. If you're jumping more forward, you're going to be hip hinging a little bit. Or if you're running and taking a step to jump, then you're going to be doing something in between. So we want to work both patterns for those plyometric sports. And then also we care about the single leg stance helps us for running positions. So the exercises that we were doing originally are helping us for our actual running patterns. But for changing directions, we can use the lunge pattern and our resistance band to proprioceptively retrain us to keep, again, those knees from collapsing inward. That's the whole thing that we're trying to focus on here. So standing perpendicular to my anchor point, I have this band pulling me to the inside. So I don't want to let the knee collapse in. I don't want to feel this arch in my front foot collapsing. I don't want to have my front foot turned out to the side. Also, back foot should be more up on my back toes and everything pointed straight ahead. I am lunging straight down, fighting this knee from caving in and moving up and down. I can incorporate holding a weight either on one arm or on the inside arm. I could also hold a weight right here, going in and out of this. And again, this is proprioceptively training my hip from caving in. I'll do this on the other side as well so you can just get a different angle. So I'm walking straight out. I have the band pulling me to the inside, and I'm going into a lunge, fighting this knee, keeping my back foot straight, core tight the entire time. You can also incorporate this into a reverse lunge, stepping in and out of this, mimicking this more in terms of mimicking more of the pattern of what you do when you are planting and changing direction in an athletic event. So all of these things are proprioceptive exercises that are training the hips, training the feet, and how to stabilize themselves and keep us straight ahead so that the knees aren't having these wonky tensions shifting them inside or outside. So hopefully you got some great use out of these exercises, guys. If you want some more help on how to rebalance not just your hips and your ankles, but potentially re-engage the core, address any thoracic spine issues, things that are going on in your shoulder girdle, we always have the free resource of scheduling a free mobility call with us where we take a deep dive into how your imbalances are occurring and how you can potentially correct those and show you how we've gotten people like Claire, people like myself, people like Robert back from not just rehabilitating their knees, but all different components of their body. Hope you've enjoyed these series, guys, and we're going to be moving on to bigger and better ones in the near future.